What we do here matters, because what we don't do matters even more.
We need to continue to push, and we at ADAO are going to continue to push the Surgeon General of the United States.
As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use.
The most horrific part of this whole story is that it is preventable.
Thank you and good morning. Well, I've been asked to talk a little bit about a special Memorial Scholarship Fund, and this has obviously been a difficult thing for me, and I'm sure for many others. Stephen M. Levin passed in February of last year. You know, we lost a very good friend and lost a champion of justice, and just one of those special people. He came from humble roots in Philadelphia, was going to start out and get out of poverty and become a rich cardiovascular surgeon. And as he got into things, he realized that's not who he was, that he saw a lot of injustice as he went through medical school in New York, and decided he was going to use his medical skills in different ways. And so he went into psychiatry and did a residency and then finished. And then he went on into practice for about 4 years, general practice. Opened up an office, had a shingle, and he was seeing workers that were coming in and they were ill from these jobs. And he could really do nothing about it. And he realized he probably if he wanted to get something done, he would have to get more education and get in a better position to do things for people, because he was going to be an advocate for those folks that were not getting a fair shake, and he always wanted to bring about that justice. So he went on and went through a residency at Mount Sinai under Irving Selikoff, and ended up staying there. And his career in medicine surrounded the practice of clinical medicine there, research, and a consummate advocate for the situations that required that. And that obviously many of the workers, and some of them are around today, know what he did for workers in New York City and around the state. But in addition to being advocating locally, he advocated in other places too. And it so happens in his last few years, he found a place called Libby, Montana. Came out to see what was going on. He believed that we were not crazy. We knew we had some problem in Libby. And he realized what was going on and the odds we were against in trying to take care of our problem in Libby with very few resources. And he spent a great deal of his last years when he was sick literally out advocating for us, trying to help people understand what our community needed. And I know he's done that for many others. And of course, he recognized the needs of the World Trade Center workers and was first in line to get programs together for them. So anyway, what I'd like to do is describe how Steve described occupational medicine, because that's what his scholarship is all about, is bringing a student of medicine into this specialty. And quote unquote, occupational medicine is work that combines clinical medicine, research, and advocacy for people who need the assistance of health professionals to obtain some measure of justice and health care for illnesses they suffer as a result of companies pursuing the biggest profits they can make, no matter what the effect on workers or the communities that they operate in. So it couldn't be said better than that, and I thought I'd better just read it, because I could not even come up with that one. But that's how he felt, and that's all we ever saw in Stephen Levin. And so Robin had just informed me that they have awarded the first scholarship to Sadie Sanchez, who came from Harvard and took the chief resident position at Mount Sinai in occupational medicine. And so they're very excited to have her there. And we're also going to be doing a fundraiser coming up in early May. And so we're going to continue to keep money going into that. We want to see more Stephen Lenz come along, and when they see what he has done, that's bound to motivate them then to I think, to follow in that type of path. And I think that's what he intended to have happen. So, so I hope everybody's aware, and certainly spread this around, that this scholarship's not just at Mount Sinai, it's available wherever a student wants to go and pursue occupational medicine. So thank you for this opportunity, Linda, and the group, and thank you.